Hello, professional nurses. This is Mrs. Ignacio with Nursing 104 lecture on Chapter 37, Stress and Coping. So when we think about stress, this is a hazard that is actually threatening our homeostasis. Remember, homeostasis is the word for steady state, internal steady state. So this can actually be a real event or situation or circumstance or alleged. It could be maybe sometimes in our minds. We create stress for ourselves based on how we perceive the world and our interactions with others. So stressors, they can be physical, psychological, or they can even be social stimuli, peer pressure. And so these different kinds of stressors can produce stress and endanger our homeostasis. So this should also tell you that stress has can have an effect on our physical bodies. So we can feel the stress in our body as demonstrated by elevated heart rates, maybe sometimes diaphoresis, sweating, flushing, tremors. We get nervous, maybe anxiety, right? So stress can affect our physical body as well as our mental health. So appraisal, how a person interprets the impact of a stressor will determine how stressed out the patient may or may not feel. Okay. So when we think about general adaptation syndrome, this is important because it breaks it down for us. There is the alarm stage. Oh my goodness, I see a pit bull coming towards me. Sorry if you have a pit bull. I'm sure they're lovely creatures, but this is an example that I always use. So this is the fight, flight, or freeze response. That is when our nervous system says, hey, you've got to do something. You got to stop digesting that cheeseburger that you had for lunch, and you've got to get all of your blood flow to your arms and to your legs because you're going to have to run to get away from this threat. So and that's just an example. So that is your fight, flight, or freeze response. Now the resistance stage, okay, and so the body is like, okay, I can't go through this, elevated heart rate. I can't stay in this condition for a prolonged period of time. So this is something that our body is, fighting resistance. It could affect our immune system if we have prolonged exposure to this particular stressor. And now the exhaustion stage happens when, okay, my immune system is totally compromised. I can face cardiovascular collapse, mental health crisis, mental health breakdown. If there is a prolonged period of time that the individual is exposed to this stressor. So that's why chronic stress, chronic trauma can create a situation where the patient may be in the exhaustion stage. There is an immune response, and we know that prolonged stress actually decreases the patient's immunity. So we know that stress is not necessarily a positive thing, especially if it's for a prolonged period of time. So we have to look at stress. And so sometimes stress in the initial onset can cause us to focus, and that could be good. But when we have this prolonged stress, it can affect our health in a negative way. So what we want to do for our patients is teach them coping strategies, how to manage their stress, how to recognize that something is actually a stressor for them. Because sometimes our patients may develop these self-defense mechanisms, and sometimes those self-defense mechanisms are maladaptive, meaning that they're actually doing the patient more harm than good. Okay, so we really have to be able to analyze that in our patients. So there's different types of stress. There's chronic stress that occurs over an extended period of time. Acute stress can be a sudden incident that has happened. Maybe something happened. Maybe there was a shooting. that just happened. And so now we're in a stressful kind of environment. We're processing what has happened. Maybe our family member was shot. Now, during this time, this acute kind of scenario, this acute stressor, this is the time where we want to get the patients, we want to offer them mental health services. If it is, for example, a school shooting, we want schools to have the child psychologists, psychiatrists on hand, grief counselors on hand, members of the ministry of different faith groups on hand to help those survivors to process their feelings so they can get the help that they need to process this so that they can move on. Okay, and resume normal, healthy lives. Because what happens if they don't get the help that they need to process everything that has gone on, they run the risk of having post-traumatic stress disorder. Post-traumatic stress disorder is characterized by three main things, which is going to be hypervigilance, always looking around, looking out for exits. Oh my goodness, I heard a sound. And quite sadly, I've been following the case of the shooting, the school shooting at Uvalde, and a lot of these students are experiencing symptoms of PTSD. One of the moms told a heartbreaking story of whenever her child that survived the shooting goes to the mall or goes somewhere. She's like, Mommy, where's the exit? I got to be close to the exit. I can't sit in a restaurant unless I'm close to the exit because if somebody comes in, I have to be ready to escape. So that's the hypervigilance. So that's number one. Number two, the kind of hallmark of PTSD is the flashbacks. Flashbacks, they're reliving that trauma, whatever it is. And so for those young children, it's Uvalde school shooting. It could have been a physical assault, a sexual assault. These flashbacks, every time they hear the radio play this song, because that song was on when I was assaulted, that gives a flashback. A lot of times these patients that have PTSD have issues with insomnia because they don't want to close their eyes, because every time they close their eyes, it takes them back to the time where they experienced that particular trauma. So number one, hypervigilance. Number two, flashbacks and nightmares. And number three, emotional numbing. They have problems with relating to their family members. Their family members may say, wow, you have changed. You no longer, talk to me, and we no longer share special moments because of that emotional disconnect they have because of their trauma that they have survived. Okay, so that's really important. PTSD is something that you're going to see again with mental health, and that is a high kind of yield thing that you'll see on the NCLEX. Okay, so sometimes there's secondary traumatic stress because a lot of times perpetrators of crimes can pick up on if someone has already survived some kind of trauma. So it's just they sense the blood in the water. So a lot of times also, if an individual has been traumatized or went through some kind of trauma, like if they have to go testify in a court of law, it's like being traumatized all over again because now they have to recount what has happened to them. And that is very stressful for our patients as well. So now there are other kinds of things that a patient can go through that are stressful. There's developmental kinds of crises. So, okay, leaving from elementary school to middle school to high school to college, moving away from home. Those are developmental, those are normal developmental milestones. Situational crisis could be a divorce. Adventitious crisis, those are things that don't necessarily normally happen. It could be a natural disaster, some kind of, thing that doesn't necessarily happen. Maybe it could be a horrific accident, a drowning or something like that. Okay, but these are all different ways the patient can have stress. So there's different, theories. I wouldn't get really bogged down on the theories. Just know that some, theories focus on how the patient responds. Uh, some theories focus on how does the patient's body respond, and Pender health promotional model is one that I studied a lot when I was at Norfolk State is, okay, promoting health in our patients and also kind of getting ahead of these kinds of stressors and giving the patient the tools in order to cope. So when these stressors do come about, they can have coping skills. Now, things that can influence our stress and our ability to cope is the situation. Is this something that is a normal kind of part of life? Or is it something that is unexpected, horrific accident, those kinds of things? Is this individual mature enough? Where are they in relation to Erik Erikson's stages of development? Also, sociocultural. Okay, what is going on in their environment, in their social, economic, cultural group? Is this something that everyone goes through? Is this something that we don't even discuss? A lot of times in certain communities, mental health and stress is not addressed. It's just like you deal with it, you keep your head down and you keep your mouth shut. And we know that that is not the best way to deal with stress. And it's okay to say, you know what, I need a mental health day. I need to take a time out. I need to take a break. There's nothing wrong with that. So, as nurses, one of the things that we can experience is compassion fatigue. Okay, it is really tough being a nurse because people will bring you their problems. People are going to be at their worst, and you have to be at your best. And so the compassion fatigue can happen to nurses. It can happen to our patients as well, but this is a state of burnout because of traumatic stress. A lot of nurses, I would submit to you, were experiencing compassion fatigue as they were caring for patients during the times of heightened COVID. So compassion fatigue. Second, victim syndrome. Okay, so this is when a medical error occurs that inflicts significant harm on a patient and the patient's family. Okay, so this is really quite sad. And so just a plug for, your dosage calculations and medication errors, that hopefully you never make one. But sometimes these errors occur and patients have horrific side effects. Sometimes they may pass away. Now, if this is a scenario, the patient that passed away was the sole breadwinner for the family, or the patient that passed away was the only parent that was parenting 5 young children. So now this causes a lot of grief, turmoil, and a lot of difficulties. Okay, so that's what we're talking about, second victim syndrome. So when we think critically about stress and the ability to cope, we have to understand, from the patient's perspective, how do they cope with stress? And that is going to be a great question for you to ask the patient. How have you coped with stressful situations in the past? What has worked well for you? Okay, we also want to really understand for ourselves how we deal with stress, because that can help us to become more empathetic to our patient. And if we have had success in dealing with stress, we can maybe pass on those ideas to our patient. So journaling may help, working out may help, swimming, yoga, bicycling, having someone to talk to. Those are all examples of how we can process our stress. Okay, we also want to think about mental health, because that is really, really important, and understanding that that mental health piece should always be a part of us assessing our patient. You may not love mental health, but I will tell you that any patient at any time with a drop of a hat can become a mental health patient. Something can go wrong. They can have a side effect to medication. They can get bad news from their doctor. Maybe they can be going through withdrawals because they're NPO and they haven't had a drink in 24 to 48 hours. And boom, this patient that is a med-surg patient becomes a mental health patient. Your postpartum moms that are going through postpartum depression, now they're a mental health patient. So we really have to make sure that mental health is at the priority for us as nurses, not only for ourselves, but also for assessing our patient. So when we are assessing our patient, we want to try to see the world through their eyes. And you may say, well, you don't have anything to be stressed out about. You have a family that loves you, so on and so forth. Well, that's the wrong attitude to have. As nurses, we need to be non-judgmental and support the patient where they are. We have to look at the world through their eyes and try to be empathetic. We want to look at the subjective findings. What is the patient telling you? What am I seeing? The patient is pacing. The patient is diaphoretic. The patient's blood pressure is elevated because they're saying they're stressed out. So also look at the environment. What kind of environment is the patient in? So when we're thinking ADPI, this is the diagnosis slide. Examples of stress and how it can affect your patient negatively is anxiety, despair, difficulty coping, okay, risk for post-trauma response, and stress overload. We can have patients that can actually have a psychotic break because of stress taking a toll on their bodies and their minds. So we want to plan for this patient. We want to plan, maybe they'll participate in group activities, they will journal, they will express their stress, and we want to set these priorities for them. We also want to involve members of the team. That could be a psychologist, a social worker, a psychiatrist, but these are all members of the team. So as we implement, managing stress and coping skills, right? We will support the patient and educate the patient, tell them about the benefits of regular exercise and getting appropriate rest and hydration, asking about the patient support system, maybe providing them with information about support systems, helping the patients manage their time, writing down a schedule that could be helpful, guided imagery and visualization, closing their eyes and meditating. That could be something to think about. Progressive muscle relaxation therapies. That's one of the things that I read about recently, that pilots do this so they can fall asleep quickly. They actually take sections of their body and starting from, the toes and moving their way upwards. And they say, okay, here's my feet, relax my feet. Here's my calves, relax my calves. Here's my thighs, relax my thighs. And then they work their way up and they're able to fall asleep very quickly. So they're progressively relaxing their muscles. There's also assertiveness training. Assertiveness training is really focused on I. So an example of an assertive statement would be, I feel hurt when you say this to me, or I am angry when I experience this kind of interaction. So it's always I. I feel sad, I feel angry, I feel hurt. It's really being assertive and letting your feelings be known to the person or people that you're communicating with. And of course, there's journaling, okay? So we want to have our patient to really be mindful and deliberate, intentional when they're managing their stress. Also telling them, okay, how to recognize a stressful, toxic workplace environment. That's something that we're talking a lot about now. So for example, Elon Musk and Twitter, they're just saying that this is a toxic kind of workplace environment. Ellen DeGeneres, there were accusations that her talk show had a toxic work environment. So this is something that has been coming up over and over again, and people are not tolerating this kind of toxic work environment because they realize how damaging it is to their mental stress, their mental health, as well as their physical health. Okay, stress management in the workplace. For us at Fortis, students have WellConnect as a resource that you can use, not only for stress, but for financial resources as well. But WellConnect is great to help you manage those tough spots in life, especially mental health and financial situations. So also we want to be able to recognize if our patient is socially isolated, if they are lonely. We want to try to prevent that by providing resources to our patient. And in an acute setting, we want to look at, okay, this is a patient in crisis. How can we get this patient stabilized? Maybe they're off of their meds. Maybe this was a highly stressful situation. They don't have a support group. They don't have a network working to help them. Okay, so these are all things that we have to look at. Restorative and continuing care, they've got to keep those those follow-up appointments with their mental health professionals. Also, what are the long-term impacts of a crisis? Here we are, it's been almost a year since the shooting at Uvalde, and we still have children that are really have PTSD, that are having eating disorders, they're having sleep pattern disturbances, they're having anxiety, they're having all of these things related to this school shooting. And so that's just one example. There are many other kinds of stressors. Think about children that are bullied in school. Um, think about college students that have survived a mass shooting on their campus. There's a lot of different things when we look at the different crises that are out there. Okay. All right. So evaluation through the patient's eyes. Has the stress been reduced? What is the patient outcome? Now, coping with stress does take time. We can't think that, okay, this happened to you, boom, now you're going to be okay. It's not just like, okay, I'm going to give Tylenol and the fever is broken. It's going to take some time. And as nurses, we have to be aware of that and acknowledge that and make sure that we're working with our patients and just reminding them of that, to be kind to themselves and to be forgiving, and to just really allow themselves to process, to have their feelings, and it's okay to have those feelings. That's really super important. All right, so here's the nursing process, of course, and that is where we end. So remember, always think like a nurse and think critically, and always, always, always think about your patient's mental health, because your med-surg patient can become a mental health patient in the drop of a dime. Thank you.